On this Wednesday night, Ontario sounds the alarm. Why is the province with the most people doing the fewest tests for COVID-19?
It's unacceptable.
Alberta's stern warning.
It all depends on how Albertans act in the weeks to come.
The Premier's plan to ramp up testing there, bolster the battered economy, and better screen international travelers as calls multiply for improved checks at the Canada-U.S. border.
They're not great.
Relaxing the rules about the emergency wage subsidy, even more companies are now eligible. And post-pandemic preparations, a top Canadian doctor on what needs to happen to ease us out of this.
Global National with Donna Friesen.
Good evening and thanks for joining us. As we all continue to endure unprecedented restrictions on every aspect of our lives, pressure is mounting to increase COVID-19 testing in this country. Until now, tests have mostly been restricted to people with symptoms and those who have been in close contact with an infected person. And Ontario has been lagging far behind. It has done fewer tests per capita than most other provinces. It has the ability, we're told, to test 13,000 people a day. Over the last 10 days, the most it's done is between 6,000 to fewer than 3,000 tests a day.
It's unacceptable. We say we can do 13,000 a day, then we need to start doing 13,000 every single day. The days are done of these 2,000 and 3,000 a day being tested. We have to make this happen, and we need to start doing it immediately, starting tomorrow.
That's Premier Doug Ford. Now, testing was limited at the start of this pandemic because of a lack of supplies and lab capacity everywhere. But that's since ramped up, and now there's intense pressure to test a much wider group, starting with frontline healthcare workers and employees and residents in long-term care facilities. Global's Travis Dhanraj is with me from Toronto. Travis, Doug Ford is fired up about this. Why has Ontario been so slow to ramp up testing?
Oh, it's a very good question, Donna, and you could hear the frustration in the Premier's voice today. He said that he spoke with the COVID-19 command table that they have here in Toronto, and he spoke to health officials right across the province, really, saying that he wants this testing ramped up. Now, initially, the problem was we didn't have enough reagent, that there weren't enough assessment centers. That problem, as you mentioned, has been fixed. So now what health officials are saying is essentially that there is a backlog from those first tests that needed to be done, that they need to get through first. They also need to give reintroduce new guidelines for testing to public health units. Now, we know that the Premier has said that he wants long-term care residents and also long-term care workers tested, and we saw how desperately those tests are needed today at a facility here in Toronto, a long-term care facility, Seven Oaks. There were 100 patients that are either confirmed or presumptive cases of COVID-19 and almost a dozen or so healthcare workers in that facility. So the Premier says no more excuses, that this testing has to be ramped up, but only time will tell in the next couple of days whether or not that becomes a reality, Donna.
All right. Travis Dhanraj in Toronto, thanks. Alberta's Premier also wants to seriously ramp up testing there and take a much more rigorous approach to tracking returning travelers who are under mandatory orders to self-isolate. Jason Kenney is aiming for 20,000 tests a day, and he says he believes it was a mistake for Canada to wait so long to close the borders, especially to countries with high levels of infection. Tom Vernon is with me from the Alberta Legislature in Edmonton. Tom, what's behind the tough new message from Premier Kenney?
Yeah, Donna, Premier Kenney says here in Alberta, we're really facing a triple threat. There's obviously the public health concern when it comes to COVID-19 and the economic downturn being caused by that pandemic. But Alberta's also facing a collapse in world oil prices, which is compounding the economic issues here. Now, you mentioned he had concerns about returning international travelers. He raised these concerns last month as well. He says Alberta will provide more resources to track and quarantine and test these people as they come back, although he hasn't said exactly what that will look like. On the quarantines, to enforce that, the Premier has also suggested the idea of using cell phone technology to ensure quarantine orders are being followed. That's obviously raised some privacy concerns here in Alberta. What the Premier says these measures are for, and as we learn more details, is truly to stop the spread of the virus.
We simply cannot risk letting the virus loose in Alberta. That would create a public health catastrophe, which would force an even more stringent lockdown in the future, leaving our economy even further battered.
Tom, the Premier is also warning of 25% unemployment in Alberta and of paying some companies to take Alberta's oil. What's his strategy to try to mitigate what he calls the greatest challenge of a generation?
Yeah, Donna, that 25% unemployment number, he gave that to a business audience yesterday. That would add up to about 500,000 Albertans out of work. So some of the steps the province is suggesting, well, he said in his speech last night that he's placing much of the blame on Saudi Arabia and Russia. They have to do take a lot of the effort in reducing the amount of supply of oil on the market. But he said there more needs to be done to supply North American energy security, work on that front. Another step Premier Kenney pointed to was Alberta's investment in the Keystone XL pipeline and getting that project moving forward. He says that will provide long-term stability here in Alberta. Opposition members here are quick to point out, though, that the Premier's vision is too narrow. He needs to look wider than just oil and gas. He needs to start talking more about diversification. Donna?
Tom Vernon in Edmonton, thanks. Well, the number of Canadians confirmed to have COVID-19 is changing rapidly. Here are the latest numbers. More than 1,300 new cases were reported today, most of them in Ontario and Quebec. With today's jump, Quebec now has more than 10,000 confirmed cases. Ontario has just over 5,200. Overall, more than 19,000 people in Canada are known to have the virus, though we know, of course, many people have not been tested yet. At least 430 people have died in Canada. Global News has learned there are no public health officers at land border crossings to test people for the virus. It's a gap in screening that potentially puts people at risk, and it raises questions about whether there's enough monitoring and enforcement at the border to detect and track people who are coming back from overseas. Mercedes Stephenson joins me now. Mercedes, BC did announce a crackdown on screening today. What can you tell us?
Well, Donna, Premier John Horgan was out and he is telling people that they're not just expected to self-isolate, they're actually going to have to show a plan when they get to the airport or come across that border crossing saying, here is how I am going to self-isolate. If they are not satisfied with the plan that is presented, which will be treated as a legal document, then they will have a plan for you and force you into isolation. That means they are concerned, obviously, that people are coming across and presenting self-isolation plans either aren't sticking to them or they're not realistic. Take a listen to what he had to say earlier this afternoon.
They will be met by BC officials, they'll be met by federal officials, and they will be required to explain in detail with forms that will be provided on flight, forms that are also available on the web, to ensure that these legal documents are completed upon arrival and that a plan has been put in place.
Donna, there have been inconsistent applications at different border crossings and in different provinces of these quarantine orders and of the self-isolation. One of the things we learned is that there are no public health officers at land border crossings. This despite the fact that publicly the government is saying when you cross the border, if you say you have symptoms, you will be referred to a public health officer. But they are not there. And the vast majority of people coming into Canada are coming through those border crossings. That's creating a lot of concern for frontline border officers who want to have someone who they can actually refer people to who are an expert in this.
And Mercedes, Health Canada apparently warned that this tracking of returning travelers would be an issue. What do we know about that?
That's right. So in documents, there's about 1,000 pages of them that were tabled at the Health Committee. There is advice from public health officials to the minister warning that they didn't even have the resources to be able to track and enforce a quarantine order against people coming back from mainland China, let alone around the world. And we have that quote for you. We can put it up there. You can see that the federal health officials said that if this approach were to be extended to China, it would be unsustainable given the volume of travelers. Prime Minister Justin Trudeau was asked about why they didn't put more resources into public health if they were receiving warnings that early about the difficulty tracking people. This is what he had to say earlier today.
With hindsight, I'm sure there are lots of things that we would have done differently, could have done differently, but I can tell you that every step of the way, we took the advice of our medical professionals and our public health experts.
And Mercedes, you've got some information about COVID-19 potentially being weaponized by terrorist groups and others. What have we learned about that?
So, Donna, as you know, intelligence agencies are always trying to figure out every possible scenario. So this isn't to suggest that there's an imminent attack or that it's just around the corner, but the RCMP has been forwarding a memo from the United States Department of Homeland Security, who they got it from, written up by railways in the U.S., warning that some violent extremist groups might try to exploit holes in security around hospitals and grocery stores where there's lineups of people at this time. Now, terrorism experts are saying that the virus has disrupted terror groups as well as everyone else, but they are nonetheless keeping a careful eye on this. The RCMP says they're always tracking these kinds of threats, to be careful with it. And of course, they're watching as well for frontline officers and military, who some groups are trying to encourage people to cough in their faces as a way to spread this. Fortunately, it's hard to know if you're infected with COVID-19, and if you are, you may not be well enough to go and do that. Donna?
All right, Mercedes Stephenson in Ottawa, thanks. Well, the restrictions that have shut down the economy are really starting to hit home now. And today, the criteria for the federal emergency wage subsidy program was relaxed. To qualify, businesses now only need to show a 15% decline in revenue in March instead of a 30% decline in overall revenue. Charities can choose whether to include government subsidies when calculating their loss of revenue. And when it comes to students, the government is going to cover 100% of wages for those hired under the Canada Summer Jobs Program. There are more broad changes too, but as Mike Couteur reports, there are still some gaps.
I'd like to place an order, please. It doesn't feel very regal, but this takeout window is the only way the King Eddie Diner can stay in business. Owner Jonathan Bonney isn't sure if he can use the government's wage subsidy program.
Be able to project revenues that, will allow for us to, make those forecasts and say, like, yeah, I think we can, hire back some of our employees.
He does have some time since the program still needs parliamentary approval.
Get moving. A little less conversation, a little more action, please.
Evoking the image of Elvis, Conservatives are calling on the government to speed up the process. The Prime Minister emerged from his own social shutdown Wednesday to chair a cabinet meeting. On the agenda was the federal COVID-19 modeling data and when Parliament will reconvene to pass the wage subsidy bill, which Justin Trudeau admits has some shortfalls.
What we've talked about over these past days is ways of filling those gaps and making sure that more people who are in exceptional or different circumstances are able to access the help we need.
Rushing a program of this size could mean a lack of checks and balances, so the government is hoping to dissuade anyone.
Anyone caught abusing the program could face penalties up to 225% of what they've received and up to 5 years in prison.
Significant penalties to protect a program that the Deputy Prime Minister says will allow the country's economy to, quote, come roaring back.
This is going to maintain that essential connection between people and their jobs, and it is going to help businesses remain fully functional and intact.
To that end, Air Canada announced it's rehiring 16,000 previously laid off employees. The airline's CEO says the wage subsidy program will help keep workers on board until the economy is ready to take off again. Donna?
Okay, Mike Couteur in Ottawa, thank you. We are getting a better sense of how many Canadians have been laid off or cannot work because of this pandemic. Since Monday, more than 1.7 million people have applied for the federal assistance program, the Canada Emergency Response Benefit. And since March 15th, the government says more than 4.2 million people have either applied for the CERB or for employment insurance. A number of people, including some accused of serious crimes, are being released from correctional facilities in Canada, which are at high risk of COVID-19 outbreaks. Some judges have cited the increased risk in the close quarters of detention centres as a factor in their decisions to grant bail. Canada's court system is shut down except for emergency cases right now, and there will be a backlog when normal operations resume. It's not clear when trials for some of the people being held in custody will begin. You can read the full story by Global's Stuart Bell. It's on our website, globalnews.ca/globalnational. Crowdsourcing the coronavirus pandemic. Coming up, a Canadian doctor's call to action. In the UK, new cases of COVID-19 are beginning to decline, but the death toll is out of control. 938 people died in the last 24 hours. British Prime Minister Boris Johnson himself is still not out of intensive care, though as Crystal Gamansing explains, his condition is said to be improving.
The world is waiting and watching. The hope is that Boris Johnson will walk out of this London hospital, but he's not there yet.
The latest from the hospital is that the Prime Minister remains in intensive care, where his condition is improving. I can also tell you that he has been sitting up in bed and engaging positively with the clinical team.
Johnson has now been in hospital in the ICU for 2 nights. He was admitted Sunday evening. At the time, he said it was just precautionary. He needed a few tests.
I still have a temperature.
The Prime Minister is not known to have any pre-existing conditions. The 55-year-old was diagnosed about 2 weeks ago. He's one of more than 60,000 who have been infected in the UK.
The news about the PM reminds us how indiscriminate this disease is. Nearly everyone will know someone who's been affected. Friends, family, neighbours, colleagues.
COVID-19 has led to the deaths of more than 7,000 people here. An emergency meeting will take place Thursday to discuss the lockdown. With the PM still in the ICU, his designate will be taking the lead. Crystal Gamansing, Global News, London.
Still ahead, the Canadians using crowdsourcing to try to save lives. Without more testing, we won't know the true extent of COVID-19 infection. Now a Canadian doctor is hoping crowdsourcing might help. Jeff Semple explains.
There's growing evidence and concern that COVID-19 might be hiding in people with no or very mild symptoms.
I don't have any underlying health issues.
Others, like Kyla Lee in Vancouver, have symptoms but were never tested.
I was advised by the doctor that unless it gets to the point where I'm essentially breathing like this all the time, not to even consider going to a hospital.
Testing is severely lacking, right? We don't have a great handle on what's happening in the community.
This Canadian professor at Harvard Medical School just launched this website, COVID Near You, mapping confirmed and suspected cases by asking people to self-report.
What if we just ask people how they're feeling? Could we get insights into what's epidemics in ways that we can never?
The website asks users in North America to type in their postal code, and from there you can see reported cases of COVID-19 in your area, as well as others who've tested negative or are showing symptoms consistent with the virus. Even healthy people are being asked to input their data, which will then be used anonymously by researchers to track the spread.
Getting the actual true sense and true idea of how many cases there are around the country will give us a better idea of where this pandemic is headed.
Another company is taking self-reporting a step further. Starting next week, any confirmed cases on Vancouver Island will be asked to share their recent contacts with this software. All of those people will then automatically be sent this email or text message alert asking them if they've developed any symptoms of the virus, and if so, to list their contacts from the past couple of weeks.
So it spreads naturally and kind of builds out a tree, all from patient 0 to whether it's a dozen people they came into contact with or hundreds, it scales infinitely.
Crowdsourcing the fight against COVID-19.
You're at home, you're Netflix and chilling, maybe try to COVID and chill a little bit, be part of a public health surveillance system. It's a few seconds to actually, really, provide some data to support Canada in its fight against coronavirus.
Jeff Semple, Global News, Toronto.
Next, learning from a Canadian doctor's international experience. This virus waits for no one, and when it hits, there is little time for doctors to do much other than try to save as many lives as possible. Dr. Joanne Liu knows what it's like to be on the front lines of an emergency. She spent 5 years as head of Doctors Without Borders. Now she's back working at a hospital in Montreal. Mike Armstrong spoke with her.
Dr. Joanne Liu says there were lessons learned fighting Ebola outbreaks in Africa, and one is that the margin for error fighting COVID-19 is thin.
There's no forgiveness in pandemic.
There's just no forgiveness, and most of the time the cost is life.
Our Syrian colleagues are there for the duration.
Dr. Liu headed up Doctors Without Borders for 6 years. The organization has more than 36,000 employees working in about 70 countries. When her mandate wrapped up last year, the plan was to write a book. But now, with her old colleagues at Montreal's St. Justin Hospital battling COVID-19, she's put the writing on hold.
Many of my colleagues and many people in the sector, they're scared. And they're right to be scared.
Liu has been disappointed in the shortages of protective gear, asking doctors and nurses and orderlies to do their jobs without the necessary PPE, she says, isn't fair. It also sets the entire system up for failure.
If we don't want our healthcare system to fall on its knee over the next few weeks, we're going to need a healthcare workforce healthy, not infected.
One of the procedures Liu suggests for hospitals is the use of spotters. Putting on and taking off PPE is dangerous, and the person wearing it is often tired. Doctors Without Borders has someone walking the worker through each step.
Take off this, do that. But it was the way that we made sure that we were not getting infected.
After the immediate concerns, Liu is also worried about down the road. What happens when this winds down? Post-traumatic stress is going to be an issue, and not only for healthcare workers. Everyone on the front lines, from grocery store clerks to bus drivers, needs help.
I think there should be a hotline. I think people should be able to debrief about their fear. They should be able to have that kind of support 24/7.
COVID-19 may attack the lungs, but Liu says governments have to worry about both body and mind. Mike Armstrong, Global News, Montreal.
And that is Global National for this Wednesday. I'm Donna Friesen. We know faith sustains many of you, especially in times of crisis. Easter is this weekend and Passover begins tonight. And the message to everyone everywhere is revise your rituals, avoid large gatherings. Even Jerusalem is under lockdown tonight. Thanks for watching. Take care of yourselves. Bye-bye.